Hi guys, so when I saw this tweet, my first reaction was, no, this has to be satire. It's not possible. And then I looked at the name and I looked at the blue tick next to the name and I realized this is no longer satire. This is actually real. Sajid Javid, the health secretary, is promoting the privatization of the NHS on Twitter. It's no longer hidden. It's all out in the open for everyone to see. So what am I talking about? You see here in this tweet by the health secretary, as we tackle the COVID backlog, we will enshrine a right to choose, giving NHS patients more options for the treatment they need. This week, I will be setting out my vision for modernisation and reform of our health service. Read more here. So he links to a Times article. I think it's the Sunday Times. So you have the health secretary talking about right to choose. Now, right to choose is a euphemism for privatization. But let's get in a little bit into the article. Just the first part, it says here, patients whose operations have been delayed will be able to shop online for hospitals with the shortest waiting times in the public and private sector. Under plans being announced by the health secretary this week, Sajid Javid will unveil a 3-point plan to transform the NHS as part of efforts to tackle the record backlog of more than 6 million people. Under the proposals, patients referred to hospital care will be able to go online and look up the waiting times at their local hospital and compare it with times at any hospital in the country, including those in the private sector. Now, what am I talking about? How is this privatization? This is about encouraging people to go private, to rely on the private sector. So instead of actually investing in the NHS, instead of actually dealing with the backlog, what the government are doing is they're offloading patients onto the from the NHS onto the private sector. And the private sector are going to make an absolute killing because there is a backlog of 6 million people. And what you're going to see is people who can pay will go private. People who can't pay will rely on the NHS. That would mean that there'll be less and less money available for the NHS because there's no incentive for the Tories to invest more in it because a sizable number of people are just going private. This has always been part of their plan. Underfund the NHS. Show that it doesn't work. Of course, it doesn't work if you don't fund it correctly. And then say, look, we need to rely on the private sector to pick up the slack. This has always been their modus operandi. This has always been their goal. And here we're seeing it. And we're seeing the health secretary post it on Twitter. Now, I recommend you read the entire article. But this idea of choice sounds very American. You're able to choose your doctor, you're able to choose your hospital, and you'll choose it based on your income, because if you go private, you're going to have to pay, or you're going to have to rely on some sort of private health insurance, and that is part of the plan as well. And there we have it. Instead of funding the NHS, of course the Tories they've underfunded it over the last 10 years. Instead of funding it correctly, so that it can deal with the backlog. And the backlog is not, he's trying to sell you the idea that it's because of the pandemic. Part of that backlog, yes, is as a result of the pandemic. But the backlog has been increasing while the Tories have been in power. Now they're trying to say, look, we have this terrible situation, we need to rely on the private sector. And they're going to promote the private sector. And we've heard how they've promoted the private sector during the pandemic as well. Members of Parliament, ministers, standing up in the House of Commons, talking about how great these private companies are, how they pulled us out of this hole. It's absolutely disgraceful. And here we have it, right here, black and white, evidence that the NHS is being sold off. Let me know in the comment section, guys, what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.